Welcome to another Radical Media interview. Joining us now is Carly Leahy, a former care home worker who witnessed patients being placed on a Midazolam protocol and witnessed them passing away. Carly, thank you for joining us.
Welcome.
First of all, as people join, lots of people are very interested in hearing your story, joining at a very fast rate. As people join, tell us about your experience in a care home. Where was it? Which town was it in? Talk to us a bit about the care home you worked in first.
Okay, I first started working in the care home in 2018.
You'll have to speak up a bit just to make sure the mic picks you up.
So I started working in a care home in 2018. It's a big chain of care homes, Order of St John's Trust in Wantage.
Yep. And how long were you there for?
I was there until I was unlawfully dismissed on the 11th of November 2021.
Right. Why were you dismissed?
Because I didn't want to take the COVID vaccines.
You objected to taking the COVID jabs, and they had a no jab, no job policy?
They did indeed, yeah. I had to have the first vaccine by the 16th of September 2021, and if I hadn't had the second vaccine by the 11th of November, I was dismissed, which I was.
Fascinating. And what brings you to this Midazolam inquest? How did you end up going from working in a care home to joining us here at Southwark Coroner's Court today?
I had my suspicions about the whole Midazolam thing while I was still working in the care home. And my suspicions were confirmed by, unfortunately, what I saw.
Yeah. What were those suspicions?
That the drug Midazolam was being used to hasten people's deaths.
To hasten people's deaths, yeah. And what did you witness while at the care home in regards to that?
I witnessed a resident who was normally active and walking fine in bed on a syringe drive with Midazolam going into the syringe drive.
Which resident was this?
She was a female resident.
A female resident?
Yeah, who'd been in the care home throughout my whole time working there.
And how soon prior to them being put on a Midazolam syringe drive, or were they walking about normally?
I saw her about a week before.
Yeah.
I saw her with the Midazolam.
Yeah.
And I saw 2 days, and then she'd passed.
So prior to that passing, for a week before that, she's walking around, able to eat herself?
Yeah.
Was she on a Zimmer frame? Able to walk unaided?
Yeah.
And then within a 2-day time frame of being put on a Midazolam syringe driver, she passed away?
That's correct.
And how do you know it was Midazolam in the syringe driver?
Because I saw that on the syringe driver, I saw that it had Midazolam on the top. I think it said 7.5 milligrams, and then underneath it said morphine, and it also said 7.5 milligrams. My knowledge of Midazolam was quite limited back then. My knowledge now is a lot more. If only I knew what I knew now back then.
What do you know now?
Well, what we've been witnessing in the inquest.
Yeah, but in your own words, what is it? What impression have you arrived at about Midazolam and what's being done?
That it was being used to hasten thousands of people's deaths.
To quicken their deaths.
Right. And those deaths were then used as COVID deaths.
And what would you say if the doctor or the nurse administering Midazolam said to you, "Oh, these people are dying. We're just making it comfortable for them"? What is your response to that?
Well, the resident in question, the female resident, certainly wasn't dying the week prior to her being put on the syringe drive, so I would question that.
Is there any more information you can give us about this resident that you witnessed being put on Midazolam in your former care home? Any more details you can provide?
I am a bit dubious about providing details because obviously they've got families themselves and they might not agree with what I'm saying.
Yeah. But you've named the
it's a
trust.
sensitive subject.
Yeah. You don't want to breach their confidentiality. Yeah. But you've named the trust and the town.
Order of St John's.
Order of St John's. You've got the paperwork at home that proves you were working there.
Yes.
And the case for your dismissal there was over the vaccines. Yeah. What have you heard today that has reminded you of a similar? Is there anything that you've heard today that's reminded you of what you witnessed in this care home?
No.
Right. What are your reflections on the proceedings today?
The attitude of the hospice consultant, I didn't like her attitude. She's coming across very abrupt, disrespectful. No heart. I mean, people that work in these kind of settings that deal with people that come to the end of their life, you expect them to have some kind of compassion, but struggling to see any kind of compassion
And do you think that what you witnessed with one of your elderly patients in the care home that was placed on a Midazolam syringe driver, do you think that the people that do this think they're doing a good thing? Or how do they justify, because you mentioned a lack of compassion, how do they justify to themselves what they're doing?
I genuinely believe they think they're doing the right thing.
Yeah. What do they think they're doing is right? What is it in their minds you think is what's going through their minds?
I think they think they're making them comfortable,
Right.
when in reality it's the opposite.
They're hastening their death. And at the time you saw this happening, you said you knew less about Midazolam than you know now.
Yeah.
So were you, obviously, understandably, you were focused on the fact that you were being sacked for not taking the vaccine.
Slightly distracted.
So were you aware at all what this Midazolam thing was? Or
Not really.
Right.
I mean, the word was floating around, and that was...
So at the time, that wasn't what was suspicious for you.
No.
What was suspicious was the vaccine stuff.
Yeah.
But you definitely remember. Was it more than one patient on Midazolam, or was there just one patient?
I only physically saw one patient on a syringe driver with Midazolam, but I have my suspicions it happened to others.
How many others?
At least one other.
Who also passed away?
Yes.
Obviously, you know the names of both of these people. You're not mentioning them out of deference and respect for the families.
Yeah.
The other person that passed away, were they healthy prior to this?
Yeah.
They were. Walking about?
This gentleman had a Zimmer frame, but other than that, he was okay.
But the lady didn't have a Zimmer frame.
No.
So she was very healthy, able to walk
Very
on her own.
happy, yeah. Very mischievous resident.
What did you notice happening to her in those 2 days? What changes came about?
She was completely bedbound,
Sedated?
sedated, 100% sedated.
Able to talk?
No,
Able to move?
no. Her lips were all dry, cracked,
So there was probably nil by mouth, no food, no water?
without a doubt.
And all of that period took over 2 days, yeah? Well, thank you, Carly, for this. I mean, it's very brave of you to speak. I know you're concerned about potential repercussions with your employment case. And
I still
already...
live in the town where it happened as well, and it's quite a close-knit little town, so that's why I don't want to name people just
No,
yet.
you're brave even saying so much that you've said already. I'm very appreciative. Any other reflections on some of what you've learned since what you witnessed about Midazolam generally? What do you think is going on in the country? What is this? What's the government doing with Midazolam in your view?
It's almost like they're trying to kill off the elderly with it.
Why would they be wanting to do that?
I feel like they're a burden on the NHS, or that's how they feel that they are, a burden on the NHS. It's just easier to get rid of them.
And it saves, are you saying it saves money because of the burden on the NHS? And these are very serious allegations that I've obviously been very vocal about in my own work. Have you encountered people finding it's too serious to take seriously, as in it's too large an accusation that how could the government possibly be doing this?
Yeah, you get accused of the normal conspiracy theories and all that, don't you? But
And how do you respond to that?
I just try and provide the evidence. Dr. Wilson size peer review paper is quite good to reflect on.
Yeah. And when you read Dr. Will, obviously I've written that up and interviewed him. When you read that paper, is that one of the things that made you remember what you witnessed in the care home?
Yeah.
You started going back through your memories and thought, oh my God, I witnessed this myself. Do you think there's a lot of carers and nurses in your position
100%.
that have maybe administered it themselves?
100%.
Talk to me a bit about protocols. Do you think that when they get told to administer this, it's obviously told to them that, look, this person's end of life, therefore, when someone's categorised as end of life, protocol, whatever, NG163 kicks in, do nurses perhaps feel intimidated that once they're told this is a protocol path, they just then have to do what they're told?
I think that's fair to say, yes. Yeah. Some, maybe not all.
And so they don't fully perhaps realise what's going on.
I think that they're wrongly trained, maybe.
Yeah.
I think it's a mixture of both. I think some know what they're doing and just don't care. And then on the other hand, I think that they're not trained properly.
What would your message be to, final question, I know we've got to get back as well, we're in our lunch break from the inquest. What would be your message to carers or nurses that are watching this, with your experience having observed this happen? What would your message to them be?
Speak out if you saw anything, because there's families, hundreds of families that are grieving and they need justice.
Carly, thank you. Carly Leahy, thank you very much for joining us today. It's very brave of you to speak. If there's any further queries regarding what we've discussed today, I'll make sure to get in touch and ask you. For the moment, this has gone out live to all of our Radical Media's subscribers, and you can find it at magicnoise.substack.com. But for the moment, we very much appreciate you speaking to us. Thank you very much. Just wait there.